All right, guys, we are going to go over the last bit of the LT3 notes. And so you have these diagrams left in your notes packet. One is, they don't look exactly like this, but one is an anterior side of a man, and the second picture is a posterior view. So when we go through these, we're going to go through these anatomical landmarks sort of by area. And as the term comes up on the screen, you will label that same region on your diagram. So if this were the diagram that we were using, these little lines would have names out to the side. So here we go. The first region that we're going to talk about is the facial region. And the diagram, I'm sure, looks very strange, but you'll notice that all the facial words are in yellow, and then there are some yellow boxes near this person's facial region. And so as we talk about each one, the box will sort of disappear and you will know what to label. So take a second and scan the words: cephalic, frontal, orbital, buccal, mental, nasal, and oral. Chances are some of these anatomical landmarks are words that you're familiar with because we use them in everyday life. So I'm betting if there was something that you recognized, it was maybe nasal and oral. Some of us might have a connection to orbital. We might think we know what mental is, but that's the one that we're always surprised with each year. So let's go with cephalic. So at the top of the head, cephalic means head. So label, draw a little line out to the side on your diagram and label cephalic as head. Frontal means forehead. Orbital is the eye. And so the words that we will use are the words that are in yellow. In the parentheses on the diagram are kind of the common terms, which you're welcome to write on your diagram. The things that are most important, though, for us are the actual anatomical terminology. Buccal means cheek. And here's the one that always is interesting to us. Mental in anatomical landmarks actually does not have anything to do with your mentality or your mental state, which we associate more to the world of psychology, a social science, meaning your brain. Mental is your chin. So that could be something that you could easily get tripped up on if you don't pause for a second to think. Mental is chin. We'll learn about muscles called your mentalis muscles. We'll learn about some mental foramina when we talk about holes that exist down in your jaw to innervate your teeth. So mental means chin. Nasal is nose, and that's probably something that you're familiar with. And oral means mouth. So those are the facial anatomical landmarks or terminology. There's only one green one, and that is in the neck region. Cervical means neck. And so some of you maybe that have some familiarity even with our spine, you know that the first couple of vertebrae in our spine are called cervical vertebrae. You might have also, if you are medical minded, you might have also heard of a cervical collar, which is kind of like a neck brace that EMS, EMTs will put you in to stabilize your neck after an accident, just to make sure that nothing is wrong as they transport you to the hospital. So neck is cervical. All right, let's go blue. So these are all arm terms. So scan the list as it comes up. Chances are you're familiar with a couple of them. If I were guessing, I think you would maybe be familiar with deltoid. Some of us know about our deltoid muscle. Perhaps you are familiar with carpal and maybe palmar and possibly even digital. So let's look at these terms. So deltoid does mean the shoulder. Axillary means armpit. Oh, sorry. Let me address the deltoid / acromial. We're going to learn it as the deltoid. When we cover the skeletal system, we'll talk about a component that makes the shoulder joint called the acromial process. And so if we kind of associate acromial to that deltoid region, it might be helpful for later. In terms of the word that I would expect for you to be able to write if I indicated the shoulder, it would be deltoid. Axillary means armpit. So you have two axillas, two armpits, right? Brachial, if we look at brachial, it is the top part of your arm. So kind of like where your bicep muscle is and your tricep on the back of the arm, but brachial is like from the elbow up. Antecubital is the front of the elbow. The back of the elbow is something different. The antecubital is the front of the elbow. Antebrachial is your forearm, so below the elbow until we hit the wrist, which is in purple in my diagram, carpal. And some of you might have some familiarity with carpal tunnel syndrome. Carpal means wrist. Palmar is, as it sounds, the palm of your hand, but notice in the diagram, it does not include your actual fingers. Those are your digits. So digital finger. Okay, if we switch over and look at some thoracic. So remember, we learned about this term thoracic when we were talking about cavities. So for thoracic region, we're going to see three: sternal, pectoral, and mammary. And I'll make a distinction between pectoral and mammary for like a clarification purpose. So sternal is really the middle of your thoracic. Some of you might call that your breastbone. It is your sternum underneath your rib cage connects in the middle. It's fused together not by your sternum, but it's fused together in the structure that is called your sternum. So sternal is right there in the middle of your chest. And then we have pectoral and mammary. So pectoral means chest, and many of you might think of your pectoral muscles or your pecs. Mammary means breast. And so anytime I would ask these two terms, because they are similar in region to each other, if I am indicating mammary, I will put the arrow or the line as close to the nipple as possible. And if I'm indicating pectoral, it will be away from the nipple, but still on that chest region. Hold on one second. Okay, if we go on to the abdominopelvic, notice the C, abdominopelvic region, we have a couple of terms. So we have abdominal, which is your abdomen. We've seen this again with cavities. We have pelvic, which is sort of low abdomen, but just before you hit any external genitalia. Inguinal is kind of the fancy term for your groin. And then pubic is referencing external genitalia. So these are our abdominopelvic landmarks. Let's look at leg. So scan these. I bet there are a few, at least two maybe that you know. Perhaps patellar and femoral, if I were guessing. Coxal means hip. So the hip region is your coxal region. Femoral means your upper leg. So from the knee up, so your thigh. And really, we talk about our femur as the very large, long bone that is in the top part of our leg, very, very strong bone. So that could you've maybe heard of your femur and could be your memory point for that. Patellar is knee. Your patella is the bone that creates sort of that, what people sometimes call your kneecap. Crural is strange to me. We don't really use this term much, but crural means our lower leg. So from the knee down to the ankle. And it went away. Tarsal, the last one, tarsal, you can look on the diagram. Tarsal means your ankle. All right, let's see. Transitioning to, I believe, the posterior view. So if we switch diagrams, posterior view. Now, some of these terms are the same as they were on the front. So scan, your deltoid on the back of your body is still called your deltoid region. Your brachial region is still called your brachial region. Antebrachial, same. Femoral, same. Crural, same. So these would be new terms that would be applied to the back posterior surface of a body. So up in the head area, again, yellow, but posterior, we have cranial, otic, and occipital. Some of you might know one or two of those. Cranial is referencing surrounding the brain. And so usually we reference that on the top or back of the head as opposed to cephalic, which was on the anterior surface. Otic means ear. So that little thing that your doctor puts in your ear to look down into your ear is an otoscope. So otic means ear. And then occipital, some of you might have familiarity with the brain, the occipital lobe. There's also a bone that protects that area called the occipital bone. Occipital is the very back of the head, kind of base of your head. If we look at sort of thoracic regions, again, thoracic regions, we're going to learn two things. So first, identify it as thoracic. And you can see in the diagram that the thoracic region is broken down into the same as they were on the front, but those terms don't apply on the back. So we'll just use thoracic as our term for anything in that region on the back. There is a term that is not on the diagram, but is on your vocab. So scapular, I want us to write scapular on the diagram. So many of you might already be thinking scapular, scapula, that's your shoulder blade. So choose a region on the diagram that would best represent kind of the shoulder blade area and identify it as scapular and maybe right to the side so you know shoulder blade. And then vertebral is your spinal column. So going down your back, but notice that it's just the blue region. You do have a spine that continues beyond the blue region on the diagram, but that would be something that's outside of the thoracic region. So for vertebral, we're really talking about the vertebrae that are called thoracic vertebrae. You have 12 of them that make up kind of the large midsection of your back if you're looking at your spinal column. We get down a little bit lower, we're talking about low back structures. And so let's go to, even though they're on our back, they are called abdominal regions. So here's our first word, is to notice that the term abdominal can apply to more than just the front of your kind of lower belly region. It can also apply to your lower back. If we go mid back, that's lumbar. And so these are really coordinating to your lumbar vertebrae, another section of your spinal cord. And then last but not least here, we have the sacral region, and those correspond to your sacrum, which are a series of fused vertebrae in your very, very low back down by your butt. So sacral region. And the last section here, we're just going to go with three terms, and they're sort of lower body terms. So there's no specific category here, but gluteal, I think you probably know gluteal from your glutes, your gluteus maximus and minimus and medius. You have the butt region, so buttock. My favorite, because it's fun to say, popliteal, that is the back of your knee. So the front of our knee is patellar, the back of our knee is popliteal. And then your heel is calcaneal. So calcaneal references specifically your heel. That bone that makes up your heel is called your calcaneus. So calcaneal region. And the last term that's up here is called plantar. It's not on this diagram, but you should add it. Plantar is the bottom of your foot. So think about stomping or planting your foot on the ground, and you would know what the plantar region really is. All right, I know that is a lot, but you made it. You made it all the way through your LT3 notes digitally, like virtually. So we will focus on the practice aspect when we are back together this week significantly. I know you've taken a lot of information down on LT3 and we need to just practice using that. So make sure that these notes are completed by the time that you come back to class. This upcoming week. If you're an A day, that's Monday. If you're a B day, that is Tuesday. So give yourself a moment to make sure that these are done and all of your notes are completed before you return to class.